Hello, I am Dr. Vijaykumar P. I am IVF and laparoscopic surgeon. We are running a hospital of exclusively Gynae laparoscopy and hysteroscopic surgery unit in Bangalore. We got two branches. We are running a workshop every month, minimum of 3 to 4 candidates, hysteroscopic, exclusively hysteroscopic workshop, where we want to train beginners or those who doesn't know about the hysteroscopy part, which is very basic. I can say it is a basic test for the gynecologist to see the uterine cavity and treat the uterine cavity pathologies or any AUB cases, DUB cases or fertility issues like that. So hysteroscopy is one of the basic tool, you can say, in the modern world. If the gynecologist doesn't know the hysteroscopy, means it is, you can say that your 25% of the skill is very reduced. So it is one of the simplest procedure. So we are conducting a training course of hysteroscopy, 3 days. We are taking minimum 3 to maximum 5 candidates only, because we want to give a lot of hands-on courses, exclusively minimum candidates, so that they can become more well versed with doing a simple procedure of hysteroscopy. We are doing a diagnostic procedure as well as the advanced hysteroscopy procedure like polypectomy, septum resection, submucous fibroid dissection, or sometimes cannulations when you are combined with a hysteroscopy, so that any missing properties, very rare cases, and any malignant cases also we can exclusively take the biopsy by doing hysteroscopic surgeries. So it is a very important mark in your career to learn the hysteroscopy. So make use of this workshop, and we are giving a both hands-on course as well as the theory part before starting the hysteroscopy instruments part, how to prepare the patient, how to assemble the instruments, how to take care of the instruments, how to maintain the quality of the instruments, how to wash it, how to assemble it, and what anesthesia uses it, and what are the complications of the anesthesia. Because even though it is a minor procedure, it has got a many more impacts if you don't use correct distension media like saline or glycine, and appropriately the use of anesthesia. So use it properly. We are conducting every month hands-on hysteroscopic workshop, so that it makes usage up to the more and more gynecologists.